Correct. Okay. Right. Again. Good afternoon. Yes, I do. Very nice. Thank you. My name is Devi Shetty. When do you want me to start?
Good afternoon, everyone. Welcome to Ribandar Talks, Innovations in Healthcare. This is the first edition of the event, and might I say, what a fabulous way to start. Because addressing us today is Dr. Prasad Shetty. He has touched thousands of lives and redefined the way healthcare is delivered throughout the country. A man of his stature really does not need any introductions. We are very honored to have amongst us Dr. Devi Shetty today, MS, FRCS from England, and Chairman of Narayana Hrudalaya Group of Hospitals. Ladies and gentlemen, please give a quick round of applause to Dr. Shetty.
Hi, I hope you have my presentation in front of you.
Yes.
Yeah, I'm going to talk about the power of purpose. Essentially, I would like to explain to you that you are at the crossroads of your life, and you, at some point in time in the near future, you have to take a decision as what I would like to do with my life. And it's a very tough decision to choose the right path. And when you're taking the decision, it is very important for you to understand the purpose of your daily activity. So that will guide you when things go wrong or things go tough. Your slide got changed now?
Yes.
Okay. 80% of the national expenditure on healthcare in India is borne out of pocket. Nearly half the country's population borrow money or sell assets to pay the medical bills. Medical cost is one of the commonest causes of rural indebtedness. So, this is the problem of our country. People simply cannot afford the high cost of healthcare. For us, if the solution is not affordable, it is not a solution. So we have to try to see how we can reduce our cost. The root cause of the entire problem is that our government spends 1.1% of the GDP on healthcare. That is, do you know how much US government spends on the healthcare? What percentage of US revenue? Can anybody guess? 17%. Yeah. There is only another country in the world which spends as much as us. You know which government is that? It's the government of Pakistan. We need to do 2 million heart surgeries a year. And just want to let you know that we are genetically 3 times more vulnerable for heart attack than Europeans. The average age of patients in England was 64. In India it is 45. It is not the young son bringing his old father for a heart operation. It is the old father bringing his young son for a heart operation. How many heart surgeries are done in our country every year? Can anybody guess? the requirement is 20 lakh. It's only 1,20,000. What happens to the rest? They perish gradually over a period of time. And in the process, we perhaps produce the largest number of young widows in the world. Are you going to accept this or you want to change? We have an opportunity. We can become the first country in the world to dissociate healthcare from affluence. We can prove to the world that the wealth of a nation has nothing to do with the quality of healthcare its citizens can enjoy. We are in a position to do that. Why? Because we produce the largest number of doctors, nurses and medical technicians in the world. Outside the US, we have one of the largest number of US FDA approved drug manufacturing units. We have everything going for a phenomenal healthcare delivery model. Now, you must be thinking that it must be the foresight of our policymakers who made this happen. I'm sorry, everything good in this country happens by default. If there is one country which is directly managed by God, that is our country. Outstanding doctors across the world generally come from deprived background. When you look at doctors who have got magic in their fingers, who can do amazing things, most of the time they come from deprived background because these are the children who have the fire in the belly to work for 24 hours and change the rules of it. But unfortunately, these children today can never dream of becoming doctors because they have no one to mentor them, and for their parents, just finding them food itself is a great task. And if they ever go to the father, says, I want to become a doctor, the father will think the son has gone crazy. So we launched a program in West Bengal. Our target is we want children, 2,000 children from villages of West Bengal to become doctors. We started with about 200 children every year, around 4 years ago. These are the very, very bright kids going to village schools. When they are 13-year-old, they should come in to us that they will become doctors. Then we give them a scholarship of about 300 to 500 rupees per month, and we mentor them. And these kids work very, very hard. They can get admission to any medical college, and we help them to get the student loan. We are essentially mentoring them and giving them a hope, telling them that if you have the dream, we are there to assist you. See, the economy of 20th century was driven by which sector? What drove the economy of 20th century?
Manufacturing.
It is driven by machines which address the human toil. And the economy of 21st century will be driven by health sector. Because this is a very, very large industry. Do you know which is the largest industry in the world in terms of money? Today it is the world's largest industry. Now, healthcare is the second largest industry. Which is the largest industry? It's the agro industry. The industry which feeds us, feeds all of us. It is the food industry. That is the largest industry. Second largest industry is healthcare industry, which is $4.5 trillion. In England, everyone criticizes the National Health Service of the United Kingdom, but very few people realize that the economy of Britain is driven by health sector. In England, the NHS distributes it distributes about $1.9 billion of salary, 1.9 billion pounds of salary every month to about 1.8 million households. And with that money, they buy their food, they educate their children, they buy their car, pay for the mortgage. It is the main driver of British economy. So health sector not only keeps people healthy, it also creates phenomenal number of jobs. Look at India. In India, for 1 crore rupees turnover in IT industry, they require 5 to 8 very intelligent people. For 1 crore rupees turnover in healthcare industry, we need to hire 250 people. And that is the power of creating jobs. And for the stability of the society going forward, employment generation is very important. In the last 10 years, across the world, there has been a lot of prosperity. But the world is unstable. Do you know why? Because money it is a jobless growth what we have seen. When there is jobless growth, there is growth. Your GDP goes up, but the money goes to very few hands. That causes social imbalance. And there is agitation, there is a problem. The entire root cause of Arab Spring is based on the fact that the young Arabs do not have a well-paying job. You may give them money, but nobody is happy taking the money without a job. So, for the stability of the world, you need to invest on industry which can create millions of jobs for extremely skilled, semi-skilled and unskilled people. And this is the one industry, health sector is one industry which can create that. We have now close to 14,000 people who are now grouped across the country. At one point of time, nearly 90% of our employees were women. With the now acquiring new hospital just come down, why it is important to create the jobs for women? If I have the job of cleaning the floor or driving this buggy, I drive the lady's husband. I hire the lady's husband and give the job and give him 6,000 rupees salary. He will spend 3,000 rupees on himself and 3,000 rupees goes to family's welfare. Instead, I give the job to his wife and give her 6,000 rupees salary. She will spend the entire 6,000 rupees on the family's welfare. And a woman who comes from a lower socio-economic background, when she is employed, she becomes an empowered woman. And empowered women will always bring up confident children. She will discipline the children. And when these children, when they grow up, they can easily distinguish between right and wrong, and they will build a great nation. So if you want to have a brighter and wealthier and powerful India, create jobs for women, especially women coming from low socio-economic strata. There is a crisis across the world about the cost of healthcare. You know, US there is a big problem in finding money to pay for the healthcare. All this has become governments across the world believe that taxpayers' money can pay for the healthcare. But interestingly, taxpayers' money could pay for healthcare in the past, but not anymore. They could pay for the healthcare in the past when people retired at the age of 60 and they died at the age of 65. Today, people retire at the age of 60 and they celebrate 95th birthday. So people are going to live longer, not working. They are working. Then where is the taxpayer who can pay for it? And also, technological innovations will create havoc. Have you seen the picture of three young men smiling in front of you?
Yes.
Have you seen the picture?
Yes.
Yeah, what is the blue bag? What does it contain? Can anybody guess? It contains an artificial heart. All the three men were admitted to our hospital for a heart transplant. We couldn't get a donor heart, so we put in an artificial heart. And they have been leading a very normal life for the last 6 to 7 years. The first young man who is smiling, he is from village. There is no stable power supply to recharge his battery of the artificial heart. So we bought him a second-hand diesel generator to recharge his battery. And he has been living on it for the last 6 to 7 years. And recently he got married. And he even produced a baby, convincing us that all his organs are working fine. We are trying to change the way healthcare is funded. And around 10 years ago, we convinced our state government to launch a scheme called Yashasvi. So first year we had 17 lakh farmers who agreed to pay 5 rupees per month. And the government agreed to become a reinsurer. And we networked with 400 hospitals. And these farmers could get any operation done in any of the 400 hospitals, free of cost. Now this scheme has been running for 4 years. Now we have close to 4 million farmers who are paying 10 rupees per month. In 10 years, what has happened? 4,44,000 farmers had varieties of surgeries, and 66,000 farmers had a heart operation. And all they paid was 5 rupees per month. So poor people in isolation are very weak, but together they are very strong. Now we are trying to convince our government. We have 850 million mobile phone subscribers who are spending 150 rupees per month just to speak on the mobile. If each mobile phone subscriber can pay 20 rupees out of this, we would have covered around 850 million people. This is the power of technology which brings people together. Just want to tell you that in Delhi, recently there was a newspaper article which appeared that the Delhi government is adding annex to Safdarjung Hospital with about 800 beds. And you know how much they are spending for each bed? They are going to spend 1,333 crores for 800 beds. It comes to about 1.34 rupees per bed. This is what government wants to spend for a government hospital. Okay. Around 3 years ago, there are 100 towns in India with a population of 500,000 to 1 million where there is no heart hospital. So, we want to build a 300-bed super specialty heart hospital in those villages, in those towns. But they can't afford to spend 100, 200 crore rupees for this hospital. So we worked with L&T. We told them that we want to build and equip a 300-bed super specialty heart hospital for $6 million. Normally in India it costs about $30 million. We want to do it for $6 million. and we wanted to build the hospital in 6 months. Normally it takes about 3 years to 4 years to build a hospital. And this is the model they created, LNP. The hospital is ready now, it is functioning. We made it in Mysore. So that's all it cost. It hardly cost 17 lakh rupees per bed. Now we have to ask ourselves, why do we have to spend so much money in building a hospital? In this hospital, after the heart surgery, when the patient is in the ward, he is taken care not by the nurses but by the spouse. We developed a curriculum. It's a 4-hour audio-video curriculum, which is developed in collaboration with Stanford University of US, how to educate the spouse to be the nursing care provider. The advantage of training the spouse is that when the patient goes home, there is continuity of care. Now you must be wondering that Dr. Shetty is talking a lot. How do we believe him? Just want to let you know that we were on the cover page of Wall Street Journal. The half the page was written about our hospital. This is about 4 years ago. Thank you. And also we are the case study at the Harvard Business School. If you join MBA at the Harvard Business School, the first case study they teach you is about us, Narayana Hrudalaya model. How do we control cost? We control cost because we respect money. We invest on technology. We invested heavily on technology. We have Oracle ERP on a cloud, which gives us the profit and loss account on a daily basis. We have hospitals in 22 locations. Every day at 12 o'clock in the afternoon, senior administrators and senior doctors like me, we get an SMS on our mobile phone with yesterday's revenue, expenses, and EBITDA margin. For us, looking at the profit and loss account at the end of the month is like reading a post-mortem report. You can't do anything about it. Patient is dead. Whereas looking at the profit and loss account on a daily basis is a diagnostic tool. You can correct. Just want to ask you a question. Which is the most expensive medical product? Sorry? MRI. It's a doctor's pen. We write MRI, and when the report comes, we don't look at it. We write for 100 different tests, and those tests cannot have any impact on the outcome. So, why doctors should be educated for the cost is because they should understand that ultimately there is only one person who pays, and it's a poor person who has sold his house to pay for the health care. So they will be responsible. So our intention is to constantly adapt, to learn how to control costs. And we also teach everybody that charity is not scalable. Good business principles are scalable. Just wanted to let you know that doctor's job is not just doing the operation and taking care of the patient. By changing the policies, a lot of things can change. You know, we have just recently, about 8 months ago, we had an association called Association of Healthcare Providers of India. The CEOs of all the top hospitals gathered together. I asked them a question. We are all cribbing about the cost. I want to ask you a question. What is the tariff you pay? What is the per unit cost for electricity in your hospital? I asked them a question. And nobody had an idea about how much they pay per unit of electricity consumed. The Do you know industries, regular industries pay 5 rupees per unit and hospitals pay 7 rupees 50 paisa. You know why hospitals pay more than other industries? Because hospitals are clubbed with shopping malls and movie theaters. The entertainment sector is the highest electricity tariff, and hospitals are in that category. So we convinced our government, Karnataka state government, that hospitals are not in the entertainment business, we are in the business of treating patients. So reduce the electricity tariff. Initially they refused to believe that we are in that section, but they realized that is the case. So they reduce the electricity tariff. So it is very important that the doctors and the hospitals not only participate in patient care, also influence the government for policy changes. Around 4 years ago, government slapped a service tax of 5% on healthcare. What does that mean? That means that somebody sells the house, pays 1 lakh rupees for a heart operation, then he has to write another check for 5,000 rupees to the government as a service tax. So we call the tax as misery tax, and we campaigned. In the end, the service tax was withdrawn. Just want to end my talk with you by saying that the world is not ruined by the activity of the bad people, but it is ruined by the inactivity of the good people. So it is very important that the good people like you are do not remain inactive. When something is not right, you come out and say it's not right. That is the only way this world will be a better place to live. All the best, and God bless. Any questions?
Good evening, sir. There's this question from one of our students. His name is Abhi. His question to you is, doctors are supposed to do internship after their studies. Don't you think graduates from IIT, IIM, GIM should be made mandatory to work for health sector, especially in hospital after their course is done, or community service?
I think some people do not like the hospital. There's no point in forcing them to work. But if they like working, they should be encouraged to work. But nothing should be mandatory. It should come from their heart. And if they want to explore healthcare industry, they should work.
Another question for the same student, sir. When you look behind, which factors do you think made NH come into reality? And how did you tackle those problems or failures you faced?
First of all, failure is part of life, and we actually celebrate failures. NH is what it is today because we believe in the power of purpose. We are here to offer healthcare to everyone, and our constant endeavor is to reduce cost. If a solution is not affordable, it is not a solution. In any part of life, you may come up with some innovation in your own area which is not affordable by the people. Then it ceases to be the solution. So we don't want to let people die, and we'll do anything to help them. And the whole philosophy is revolving around that cause. Yeah.
Another question from one of our students named Ritu. What makes one successful healthcare provider in your view?
I think every healthcare provider in India is successful in his own way. Some cater to the affluent and some cater to the underprivileged. There are buyers for the Rolex watch and they are buyers for a Titan watch. I wear a Titan watch. So for everything, there is a market. So we serve a different section of the society.
Okay, this is from one of our faculty members, Mrs. Meena Kalpekar. She first like to know, how would you describe innovation in healthcare?
You see, when we talk about innovation, what comes to everyone's mind is the iPhone, iPad, all these innovations in the mobile phone. These are product innovations. The next big thing in healthcare is not going to be a product. That is not going to be a magic pill or a fast-paced scanner or a new operation. It is going to be changing the process of the healthcare, adhering to the protocol and bringing down the price. And we are in the process of developing software which would, in our mind, will reduce the mortality in the hospital following any intervention by 50% and to reduce the cost by 25%. So this is going to be the next big thing, that is using the software, using the IT for streamlining the process of delivering healthcare. So we believe that innovation can only happen in India because we have brilliant software engineers and we have large number of patients. So this is what we are trying to do.
Okay, sir. And this is another question. One of the hospitals you founded has been designed to have cross ventilation instead of air conditioning. Is it cost cutting or environmental concern? If both, in what proportion?
This is the Mysore hospital where we built, I showed you the picture of the hospital. In this hospital, we have no central air conditioning in areas other than the operating room and the ICU. Everywhere else, we believed in the cross ventilation and natural ventilation. You see, contrary to the belief, central air conditioning doesn't prevent infection. Most of the time, it is a cause of infection. Best sanitizer in a hospital is the fresh air and sunlight. And modern hospitals do not allow the fresh air and sunlight to come in. So we designed the hospital with that concept of natural ventilation. That will reduce our cost significantly, and we also believe it will improve the outcome.
Another question from Aruna Rathod. Normally, people don't mind spending 150 rupees for one movie show, but refuse to pay the same for healthcare service. How can this problem be tackled?
That's a very interesting question. Yeah, it's because, see, you forget about the educated people. You look at the, I'll talk about my experience of how people look at paying for the healthcare. Let's talk about a health insurance. 10 years ago, 12 years ago, I was going to villages trying to convince farmers to contribute 5 rupees per month to get any operation done. So I was explaining to an old man, I told him that you have to pay just 5 rupees every month. One packet of BD costs you more than that. I'm sure you don't mind paying 5 rupees. And any time in this year, if you need a heart operation or a brain operation or a cancer operation, it will be done free of cost. Then he would smile and say, that's very good. Then, after a pause, he would ask a question. At the end of the year, if I don't get the heart operation done, will you return my 5 rupees? So this is the knowledge people have. Essentially, nobody wants to pay for the healthcare, given a choice. But reality is that somebody has to pay for it. In good old days, it was the taxpayer. Now, taxpayers can't pay for it. It is becoming very, very large. So, we thought the next option for people is to pay a tiny amount of money through their mobile.
This question is from one of our faculty members, Ajit Parkar. Why are there so few Dr. Devi Shetty, Dr. Badrinaths in the system today?
We are some of the privileged people. It has nothing to do with us, it is the circumstances. We were born at the right time and the right place, and a lot of good things happen to us at the right time. But given the same circumstances, any one of the doctors you know of would have done exactly what we have done if they were in our position. It has nothing to do with us. It is the circumstances which makes us do these things. Yeah, I don't think it has got anything to do with the personal virtues of me, at least. I think it is the circumstances. Yeah.
This question is from one of our students, Star. Free government medical seats don't give any weightage to how much social good a candidate is likely to do. As a result, they study for free and go to US. How can this be resolved?
See, that's a major issue in this country, and we are fighting to resolve it. The US has 19,000 undergraduation seats and 32,000 post-graduation seats. We have nearly 48,000 undergraduation seats and only 14,000 PG seats. So people spend 2 years to 5 years in coaching classes, mugging MCQs to get into a post-graduation training program. And a lot of them get frustrated and they go to US. It is sad. So we want them to change the entire selection process. We want them to create surplus PGCs. And it is possible. Things are going to change. We are going to make it happen.
And a final question from one of the students. How, as healthcare managers, can we reduce out-of-pocket expenditure in India?
The only way is health insurance, micro health insurance. We believe that everyone should pay a tiny amount of money for the health care when they are well. But when they are unwell, they shouldn't pay anything. So this is what we want to do, and God willing, it will happen.
Do you have one more question?
Sure.
How can we change Indian healthcare scenario? Any mantra by one of our faculty members, Dr. Harish Siddharth?
See, our biggest problem is the indifference by the civil society. Unless the civil society demands better health care for people who are not privileged, as privileged as us, things are not going to change. I'll give an example. In this country, every 10 minutes, one young lady dies in a village during the process of giving birth to a child. Childbirth and pregnancy is not a disease, but she dies every 10 minutes. We have the highest maternal mortality rate in the world, worse than sub-Saharan Africa. Why? because we only have 40,000 gynecologists. We need to have 1.5 lakh gynecologists. Now, why this is happening? We have every year 3 lakh children die the day they are born. Why they die? Because they are not our children. They are the children of who? And it doesn't bother us. As long as the privileged society doesn't ask questions, things are not going to change. It will always remain the same. So we have a hope. Our hope is you, all of you, the younger generation. You should spend 10 minutes of your day in questioning these things. How can you allow young ladies to die during childbirth? It is unacceptable. But it will continue to happen if the civil society doesn't question. So we are in this mess because we don't ask questions as long as it doesn't bother us. When it hurts us, we start asking questions.
Okay, we have more questions, but this will be the final one.
I have to go back to the operating room. I'll answer this question and then I have to leave. Yeah.
Prevention is better than cure. How can we bring innovation in preventing diseases and enlightening people to live healthy way?
See, definitely prevention is better, but it's very hard to educate people about changing their lifestyle, changing their diet, quitting smoking and all the rest, because our government spends very little money and the resources for campaigning and educating people against these lifestyle disorders. Once the government takes it like a campaign, it will happen.
Thank you so much, Dr. Shetty. It makes really a lot of difference to us and our students. The passion with which you speak is very apparent. We just hope that we get a lot more opportunity to hear you and maybe sometime even have you on campus. Our students some of our students have visited